Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you are suffering from symptoms like irregular menstrual cycles, difficulty conceiving with your partner, or you have sudden hot flashes, which is periods of extreme perspiration and heat under the skin, especially at night, your doctor may have advised of FSH or follicular stimulating hormone blood test. I'm going to tell you everything about this test in this video. So what is the FSH? Its full form stands for follicular stimulating hormone. Every time you have your menstrual cycle, there is something called the ovarian follicle, which is initially developed inside the ovaries, and then around the 12th to the 15th day of your cycle, it is released by the ovaries. Now, the growth of this follicle is under the control of this hormone called the FSH or the follicular stimulating hormone. It stimulates the growth and maintenance of this hormone and also has roles all the way up to pregnancy. This is measured by means of a simple blood test, and now we'll find out what and how this test is done. The FSH test is a simple blood test in which you need to visit your lab. They will insert a needle into the vein in your arm and draw a couple of ml of blood. This will be processed in the lab and you will be provided with a result on the same day or maybe the next day. The result will contain a single number, which is the value of the follicular stimulating hormone as measured in your blood sample. How do you prepare for this test? Well, there's no special preparation required. You don't need to be fasting for this test, but we recommend that you provide your sample within the first 2 hours in the morning. Secondly, if you're on any kind of supplements, hormonal supplements, or you're taking something like biotin, it may affect the test results and you should inform your lab about the same. The test is usually recommended to be done in women between the 2nd to the 5th day of the menstrual cycle. Other than this, there are no other requirements. What are some symptoms that you may be experiencing which could point to a problem with your FSH levels? So here's an incomplete list of symptoms: irregular periods or absent periods where you may not even have your cycle. Hot flashes, which are sudden periods when you feel extremely hot, that you perspire and you may feel a burning or a warm sensation under your skin, especially at night. Night sweats, where you tend to perspire a lot at night. Reduced libido or sex drive. Increases or sudden changes in your weight. Mood swings are all signs that there may be something wrong with the overall control of your menstrual cycle and therefore your FSH levels. What are some of the reasons because of which your doctor may have advised you to do this test? Well, the first is fertility evaluation, especially if you cannot conceive naturally with your partner. Your doctor will definitely advise the FSH level as a part of the overall panel of tests. Secondly, diagnosis of problems with the pituitary. Now, you know that the FSH is secreted by a gland in your brain called the pituitary gland, and anything wrong with this pituitary gland will have corresponding changes in the FSH levels. So it allows us a way to also check whether the pituitary gland is functioning normally or not. Next is menstrual irregularities, where your periods may be absent, irregular, or you may have periods without ovulation. Next is ovarian function. There are situations in which the ovaries don't function properly. This is called ovarian failure, and FSH levels allow us to check whether this is happening. And the last is PCOS, which is called polycystic ovarian syndrome, in which there are higher than normal level of male hormones or androgens in a woman's blood. This causes problems like infertility, irregular cycles, hair growth on the face, etc. And the FSH level is usually advised, or the FSH test is usually advised while evaluating a woman for these symptoms or for this syndrome. What is the normal level of the FSH or follicle stimulating hormone in a woman? I've included the list of normal ranges on this page. You have to understand that the level of the FSH changes throughout the cycle and also after menopause, so please take a look at these ranges. Now, what are the top reasons because of which your follicular stimulating hormone report may show some abnormal levels? So you will find abnormally high levels in 3 situations. Number 1, when your ovaries are not working properly, they are not causing your eggs to develop properly, your FSH level might be abnormally high. Secondly, if there is something wrong with your pituitary gland, that could cause your FSH levels to rise. And thirdly, if you have puberty too early, that could also cause your FSH levels to rise. What could cause a normal or lower than normal FSH level? Well, PCOS may show a normal to lower than normal FSH level. So you need to know these basic reasons for abnormal levels of FSH in your report.